officials believe that it all started in Wuhan, China. It's believed that the virus may have originated from a market in the city where people can buy an assortment of wild game meat.
A dangerous virus is spreading rapidly in China, and U.S. officials are very worried that it could come here. China has more than 200 confirmed cases of coronavirus, it's called, which produces pneumonia-like symptoms. 3 people have already died from this illness, which has spread to at least 3 other Asian countries. New video sent to CBS News claims to show hospital staff wearing protective gear, and that is protective gear, in Wuhan, China, considered ground zero for the outbreak. Raimi Inocencio is there. Raimi, what are you hearing?
Good morning, Gail. Yes, people here are understandably very nervous, especially after the number of infected exploded over the weekend. The airport here in Wuhan has also started to do body temperature checks of people before they take flight. Not only that, when we landed here in Wuhan earlier today, we saw people, many of them wearing masks around the baggage carousel while we were waiting for our own bags. I took that video there, and you can see people are nervous about the situation. Not only that, taking a look at what's happening in the United States, U.S. officials want to make sure that they're raising the defenses, and that is what they're doing there, because right now, as of now, there has not been a U.S. infection as of yet.
The first death from coronavirus here in the United States. A man in his 50s dying from COVID-19 infection in Washington State. Authorities describe him as an at-risk patient, but say he had no apparent travel to China. It is one of several new cases there. The governor declaring a state of emergency. The mysterious and deadly virus. Tonight, authorities confirm it is being spread from human to human. It started in China, and it comes as the number of confirmed cases has now quadrupled since we first reported on it on Friday night. More than 200 sickened, at least 3 people dead. Passengers arriving at some major U.S. airports are now being screened.
Yes, because as a nurse, they educate us on the virus before it even came. My initial thought was, I thought I wouldn't have to go back to work. Being as a nurse and being a frontline worker, I had to go back to work. So it never really affected me in any way possible. Due to the fact that the numbers are increasing because people are not wearing their masks and not following proper guidelines, people don't take the virus serious. But being a nurse and seeing people that's in the hospital, people coming, they're sick, they're dying, I think it's going to last pretty long. I think that if they don't find a vaccine, which they're working on, it's going to continue to last. I mean, no, I wouldn't say I was scared. I mean, I'm pregnant. So that is kind of scary because I am carrying child. But being, working in the environment, no, because I've come in contact with a lot more other things. This is just worldwide. But I've seen other diseases. You just have to protect yourself. Because the first rule of nursing is you treat everybody like they have an illness. Since I'm a nurse and I'm working with people, I'm a psych nurse, so I work with people that come off the streets. We don't test them because they're homeless and they don't have to be tested unless they have symptoms. What I do is, at work, I wear a mask at all times. If I do go into the patient's room, I gown up. I have the PPE, which is personal protective equipment. I have a shield on. I take extra steps because I'm pregnant. So I wear gloves. If that's the only reason I go in the room is if they can't walk or incapable of coming to me to get their medicine. I make patients come 3 feet apart at my job. 3 feet apart, 6 feet apart, and 3 people at a time. Now when I get home, I take all my clothes off. I go straight and take a bath. And I take those clothes and put them separate and I wash them. I have certain shoes that I wear to work that I put to the side and at the door. I do not. You can't breathe. It is the worst thing ever, but it protects you and others around you. It's not just for your protection, it's for others around you that are sick. Because you could have a strong immune system, and you can also be an asymptomatic carrier, meaning that you don't even know that you have it. So it's pretty much protecting everybody around you. It did not affect my health in any way possible. I think I'm just happy that due to the fact that I'm pregnant, I've never caught it, knock on wood. But I do everything I can, hand washing, hand sanitizer, just doing the motions of what you need to do to protect your family. So no, it never affected me. I haven't even caught a cold. You take your vitamins and medication that's needed, since there's no medication that could treat it. My final thoughts is people need to take it serious. It is killing people. It is a danger to society. It really is. So people need to make sure that they wear their masks, clean their hands, 6 feet apart, social gatherings, limit that. Be careful, because it is taking a toll. People not realizing how serious it is. It all depends on your body. Some people it hurts. Some people don't. Some people treat it like a pass, like a cold. It all depends on your immune system. But it's serious, and people need to be prepared for whatever comes.